Ajit,
So for this condition,
we have a lot of questions about, no, we have a lot of cases on hotline and questions in social media, of course, about pain, and especially with Omicron, pain in throat, and sometimes severe pain in throat. Let us make a differential diagnosis between main remedies for this symptom.
the first thing very important, we have a rubric, pain throat virulent. But if you read this rubric, unfortunately, it is not a very good rubric being prepared. So I don't give value to this rubric. I have my own repertory of violent pain in the throat, and I will send that to you, my rubric which I prepared.
Yeah,
Okay.
we will appreciate it very much.
Yeah, yeah. Now the first thing very important is very simple solanus remedy, that is belladonna. Belladonna has very severe pain, throbbing, as well as you will find constricting. So belladonna with extreme redness, few hours, and the pain is very severe. You know why there is a more severe pain in the throat in COVID-19? Because the virus wants to go down. And this throat, posterior nares and palate and sinuses, there is a big cavity. And in this cavity, the virus goes and starts replicating. And then there is a big fight. The big fight is present in the throat. The system doesn't want the virus to enter deep in the lungs. So the fight produces the inflammation and consequent pain. The belladonna is for a few first hours. Then if it doesn't help and the pain is very severe, remember a very important remedy is Merck cynaticum. This is a very active remedy because of cynaticum. You know, cyanide is a poison. It is a very deadly poison which causes the death within minutes. So it's a very venomous drug which causes very severe pain and inflammation. Then in my COVID scope book, I have already differentiated between Merck Sol and Merck cynaticum. In Merck cynaticum, the pain is very acute and severe, and patient cannot swallow at all. It cannot touch even. This modality of even touch as a stimuli is like hypersulfuricum. So you get a picture which is like Hipar, which is like Merck Sol. So it's a combination of both of them, that is Merck cynaticum. Then if you examine the throat is not only red, but it is dusky and dark. It is like a cyanide, no? After the cyanide poisoning, you will find the body becomes cyanose. So you are able to see the same situation. There is a dark duskiness which is available in the throat. So with severe pain, you get this modality, and then the modality of Hipar, Merck, Cor, Merck Sol, and Merck cynaticum is the same, better by warm drinks. So with Merck cynaticum, you have every chance to relieve the acute severe pain in the throat. Okay. Then there is a very good remedy which I use in one patient about severe pain, and that was Phytolacca, Decandra. Phytolacca has more, burning and pain which is extremely excruciating. But the modality is very clear, better by cold drinks. So I found only one patient. Up till now, all patients have better with warm drinks. This was the patient who gave exactly opposite modality. And Phytolacca, within one day, remove the pain in the throat and the cough also. Never forget Phytolacca for cough symptoms also. It's a very important cough remedy in pediatrics especially. Yeah. And then according to the totality, you can go ahead. Lachesis, for example, can help considerably in relieving the pain, acute pain in the throat in Omicron especially. Yeah. And then according to the left side and the right side, You can use a Merck IR for left and Merck IF for the right side. If the patient starts complaining that this left side or right side is extremely painful. So instead of going for Merxol in general, you can have a specific Merck which can be of more use in such cases. Then in one case of Omicron with cystitis and very severe pain in the throat, I use Cantharis because you know the characteristic concomitant of Cantharis is the association of the urinary symptoms. So Cantharis help the system to go with both infections together, throat and cystitis. Very good results associated with burning and chilliness, which are also the characteristics of the Cantharis.
Very, very important to know. And Ajit, only 1-2 words about conditions in pain, painless. I mean, conditions in throat painless, like silica, mercury. We know what that. This is an opposite situation. There is something in a pain, but and it could be even very inflammatory, but without pain.
Yeah. The first remedy when you expect pain and the pain is absent in acute inflammation, that is Stramonium. It's a remedy which covers two polar opposites, the pain which is severe and also the painlessness which you expect. This is the first remedy. Because it comes from the Solanaceae family, you always find polarities. That the second remedy, which is very important for painlessness, is Baptisia. Have you used Baptisia in inflammation of the throat, but there is no pain? You examine the throat and you find that yes, it is red, it is dark, it is full with pus, patient has high degree temperature. So you expect pain, but it is not present. The patient is toxic. The third remedy, which I like very much and I am using for a lot of things because Tarkas made a very good relationship of this remedy in the absolute, that is Carbolicum acidum. This is a remedy with very severe inflammation, mucopurulent discharge, suppuration, but pain is absent because the system has no power even to produce the pain. That state is over. That collapse state is present. This is Carbolicum acidum. Then there is a very good remedy which I use in mucormycosis as a fungal infection which occurred in India as far as the second wave was concerned. That is sickle core, which is also a remedy for painlessness when you expect that with inflammation, more of a gangrenous type, more of a dark and black type of the lesion, you expect sickle core to help your patient. Yeah. And I don't know whether you have used typhoidinum as a remedy. Previously, we had typhoid when I began my practice. So during 1985, we had typhoid enteric cases in India much more. Now they have much reduced. But previously, I used to use typhoidinum as a post-typhoid nosode to finish the sequelae or complications of typhoid. So I found that typhoidinum is also a very good remedy for pain in the throat when you expect and it is absent. So painlessness in a inflammation of the throat. This is typhoidinum. Yeah.
Ajit, thank you very much.
Okay.
Thank
yes,
you.
Roman. So I take your leave now. Yeah. Take care.
Take care. Bye-bye.
Bye-bye. Bye.